Hi, this is Ben Gideon back again for our third in the series relating to the case I tried involving bacterial endocarditis. So we've seen how the heart is supposed to function normally. We've now seen how bacteria gets into the bloodstream and can infect the heart, how that's supposed to be diagnosed and treated. But what happens when it isn't? What happens when, as in our case, our client went for about 8 months with a positive blood culture that nobody reported out and nobody acted on? So the bacteria were allowed to remain on his heart valve, eating away at the valve that whole time. So we have another series of visuals to describe what happens when that occurs, what happened to our client. So first, we show the jury that if the bacteria are allowed to remain on the heart valve untreated, the infection will continue to get worse and worse, and it will eventually damage the heart valve. So here we show the mitral valve again. The yellow is the bacteria that's on that valve. And over time, the bacteria eats away, so the valve is no longer working the way it's supposed to. We want to show the jury again on the left a normally functioning valve where the valve closes all the way. And then on the right, we have a damaged valve where there's still a hole in the middle, even when the valve is in the closed position. And when that happens, it is not able to do its job of preventing the backflow of the blood up from the ventricle back into the atrium. So this allows for backflow through that hole in the valve, which is also called regurgitation, mitral valve regurgitation. So when the patient has a damaged heart valve from bacteria like this and has mitral valve regurgitation, then that backflow into the atrium damages the atrium. It causes it to enlarge because there's now more blood in the atrium than there's supposed to be with each pump and upward pressure. As you can see here, the atrium enlarges. We also want to explain to the jury that that process can affect the normal rhythm of the heart by interfering with the electrical signals that we taught them about in the first animation series. Instead of the chambers beating in normal sequence, in normal rhythm, now the atria, the top chambers, flutter about, a condition called atrial fibrillation. You can see that it's not beating in a nice normal rhythm anymore. And when that happens, the blood can become stagnant in the atrium, and that can allow the blood to clot. Blood clots in the heart are very dangerous because they can then break off, and pieces of those can be pumped out to the body and to the brain and cause a stroke or cause a host of other problems. So people who have this condition called atrial fibrillation are usually placed on blood thinners, which they have to take for the rest of their life. In our client's case, he had to do that. And being on blood thinners comes with a whole host of additional risks as well. So when you have the damage to the mitral valve and you've got upward pressure and extra blood going back up into the atrium, you also have downward pressure and extra blood remaining in the ventricle that over time will cause the entire heart muscle to expand. The reason for that is because that greater volume of blood requires extra force to pump it out, making it more difficult on the heart, putting it under extra stress. So that extra strain and volume overload damages the heart, causes it to grow larger and reduce its pumping power or its efficiency. And we had explained to the jury in the first set of visuals that the the heart pumping that blood out is needed, obviously, to do everything you do in your life. And then when the heart is less efficient, you have a lower ejection fraction, meaning that on each pump, the heart is able to pump out less blood. And that affects you in everything you do in your life, from walking to running to doing any kind of activities, fatigue levels. Um, just overall, you're not going to be able to have a normal life or to do the things you enjoy doing. And you're not going to feel good if you don't have a properly functioning heart. So it really has a wide ranging and very devastating impact on a person if you have this happen to you.